They told me that they don't have a nephrologist here in Belize. If I would go to the hospital and I would tell them, I am on dialysis, I cannot take this, I can't take that, they would get mad with me and said, okay, I am the doctor here.
It has been very challenging without a nephrologist in the country, especially for us here at La Luz. Very challenging.
I was born in Belize, and I've been wanting to offer some help to the country from a medical perspective for many years. And a few years ago, I finally got the courage up to approach the medical establishment at the hospital in Belize City to find out if they needed help. And they said, yes.
So when I heard about Dr. Hyde, that was so nice, you know, for him to come and share his time with us and spend some time with us also.
Which he has done a very good job explaining on our results that we do monthly, which are hematology and chemistry.
I've been coming to Belize every 3 months, and in between those visits, I've been sent documentation of the patient lab results and their blood pressures. And so I've had some communication with the staff, mostly by email. And so while I am very comfortable with the clinical aspects of caring for dialysis patients, having more support from a technical point of view has been more of a challenge, and trying to transfer the quality imperatives that the Vita has put forward for the dialysis centers I work at in Arizona to Belize has been more of a challenge.
2 years ago, I attended KT's leadership conference before Village-wide, and he said something that resonated with me. He said, "Don't let your music die inside you." And I had an idea of mine that to connect people in distant lands with physician specialists in the United States.
My role was to evaluate the feasibility of utilizing a telehealth solution in developing countries. More specifically, I worked with La Luz Adventist Hospital and their IT director to understand their needs and their capabilities.
Through our connection with healthcare partners, was able to afford us a technology to be able to connect people in distant places, remote parts of the world, to physician specialists in the United States.
So the next steps were to work with the other IT teams in DaVita Kidney Care as well as healthcare partners to determine the optimal solution based on what we found out about capabilities and limitations.
I had been involved with some of the technological aspects of some telehealth pilots that we had done at healthcare partners. So MeU Health is a video-based capability that allows two people or more to be able to exchange messages.
I thought he was still.
You finished the detail after.
Modern technology. Hello, Nes Casimiro. Yeah, good morning.
Well, it was 2 years ago that we first started it, and we ran into some roadblocks and obstacles along the way, but we stuck with it, and we were able to overcome all of those obstacles and to finally put it all together. And here we are today in Belize with a connection to the United States.
We expect this program to have a very positive impact on the patients in Belize because of the increased number of interactions that will happen between those patients and their physician.
Having Dr. Hyde communicate with us, or we communicate with Dr. Hyde, is going to be very beneficial. It's like having him present here with us.
If I could talk to Dr. Hyde each week, I know he would say, Aralyn, you need to do this, you need to do that. I feel like I could come to Dr. Hyde if I have a problem and say, you know, Dr. Hyde, I am not feeling well.
This medical mission to Belize was a perfect marriage of teamwork, technology, talent, and trust between healthcare partners, DaVita Kidney Care, Bridge of Life, and Dr. Hyde.
I was really gratified that the people at Bridge of Life were so persistent and so cheerful in pursuing things and in convincing everyone to work through the process.
We want to say thank you, and I want to assure you that we will make the best use of this donation that has been given to us.
Patients, I think, will feel more cared for and just less stressed to know that they have more frequent access to their physician. This is a pilot, and we'll be closely looking at the results and then look forward to rolling it out to many partners and countries all over the world.